Southwest Texas Methodist Hospital was the first facility in the South Texas Medical Center. They started construction in the late 50s and opened in 1963, and it grew to be the premier healthcare provider in this area. And in December 1994, John Hornbeek was the president and CEO of Methodist Hospital at the time, and studies showed them that a standalone hospital would not survive in changing healthcare environment of reimbursement. Health insurance companies were going to require that you have multiple geographic locations to serve the community. So John Hornbeek held a private meeting in his home on a Saturday morning to talk about the next option. And most people were incredulous about the suggestion that we have a for-profit partner. But board members will tell you now it's the best decision they ever made for our community, because HCA is a premier healthcare provider in our country, and our board's responsibility is to ensure that quality healthcare was available to all members of our community, regardless of their ability to pay. And so it is a 50-50 partnership for that reason. And the board members who were at Methodist Hospital transitioned over to become the board of Methodist Healthcare Ministries. And they came with that passion for providing services to the community. To develop the mission statement, they started with the serving humanity to honor God. At the time, actually, it was serving man to honor God. And that is still on the cornerstone at Methodist Hospital. That was always their mission. And so they knew that they wanted to keep the same statement, but they had to define what that meant for them as a new organization. And so after many conversations, they determined that they wanted to do something that no one else could do or would do. And who would that serve? So that's how it came about, serving the underserved, uninsured people in South Texas, because no one else could or would do that. Now, did they ever imagine that we would be at the level we are now of clients served or the money spent to provide services? No way could they have imagined that. And each one of them would tell you that God has been gracious to us and provided to us to allow us to fulfill this mission.
From that first plan in 1996, where we had a budget of $802,000 and served 1,100 patients, to today, 370 employees, 785,000 patient visits, with a total budget of around $77 million a year. We had 3 nonprofit partners in 1996 in the community. Now I can't even name them all. There's 90 of them. They're receiving funds from us to the tune of $25 million a year. The key element of our organization's support to small nonprofits is that we've stabilized nonprofits that didn't have any money to expand their services to more of the patients that they needed to be expanded to. So we've provided great stability to the communities that we serve. Plus, we've enhanced those nonprofits to provide an additional amount of services in every community we've gone to. In Corpus Christi, as an example, we worked with that community for 5 years to create the FQHC because one didn't exist. And we've done a lot of that creation in a lot of different communities. Those 2 doctors we had in 1996 were working out of the old Wesley Community Center. That process of building a new center, a new site, putting more physicians and more staff at that place has dramatically changed the area around the Wesley Community Center, now the Wesley Health and Wellness Center. You just can't imagine how their lives and their families' lives and their neighborhoods' lives have changed dramatically because of what we've done. The board's strategic plan said, let's do a couple of things. Well, primary care, dental care were a couple of those. And then they wanted to get involved in parish nursing. And we came up with the Wesley Nurse Program. Our parish nurse model is the largest in the nation. And talk about having an impact on community. Each of these nurses in each of these churches is out there every day and creating the relationships and the partnerships that then result in other contracts in this organization for the provision of primary care and dental care and counseling services and mental health services. The New Testament tells us to take care of people where they are and to provide services and care, and that's how we get the primary care and the dental care model. But the Old Testament out of Micah tells us to work on social justice. And you can't get justice without working on policy. And if we could change a policy, we could change the lives of more people. And there couldn't be a better policy guidebook for Methodist Healthcare Ministries than the Methodist Church's social principles. In the 20-year history of Methodist Healthcare Ministry from 1996 to today, we've invested nearly $700 million in these communities, and we've almost touched 8 million patient visits in that same period of time. Amazing amount of work, and just think of all that we'll be able to do into the future. The key element to our success as an organization has been several things. One, our connection to the Methodist Church. Without being connected to the Methodist Church, we'd lack a guiding post. We have it. We also have a dedicated board made up of 60% Methodist, and that board is absolutely tied into strategic planning. Every 4 or 5 years we do a plan, we look at what we've accomplished, we don't sit down and say this is enough. We use our Wesleyan quote to say, nope, it's not enough, we have more to do, and we figure out what that is. And that will continue to give us great success into the future. If we stay faithful to our faith traditions, and if we stay faithful to the least funded, unfunded patients and clients that are in need in South Texas, then we're staying faithful to John Wesley.
I think just as the founders could never have imagined where we'd be today, it's hard for me to imagine where the company will be in 20 years except continuing to do what they're doing now, serving underserved people.
I'd love to see Methodist Ministries in the next 2 decades ramping out programming regionally similar to what we've done in Bear County, both our own, both with funded partners, expanding our reach to the regional areas that we've put in our strategic plan that absolutely need our services.
We've spent the last 20 years funding community-based organizations. We've spent the last 20 years building our own footprint of providers and services. And so where I see us in 20 years is our work is more about how do we intentionally weave those systems together? How do we align and leverage those?
I believe the work that we're doing in collective impact and our SIF grant, working with other partners that are non-traditional to us, I believe that's giving us the basis to be able to develop some integrated care networks that can help serve our patients in the future.
I think our strength at the moment is the fact that we've matured now 20 years. We have 20 years of experience to have maybe a better way to position ourselves to be able to respond. We can predict to a certain extent, but a lot of it is responding to landscape changes that maybe we didn't predict.
Well, MHM will help us tremendously because they are already very much working on the primary care side with Wesley nurses, very closely with communities in this part of Texas. Their advocacy is going to be very important for us to work closely and in collaboration together so that we can have a voice for what is best for healthcare development going forward.
MHM is well positioned because we're very well known in the policy arena, because we're one of the largest healthcare funders from a philanthropic perspective, and then we're also a provider, allows us to have an incredible opportunity to influence and reshape what that looks like.
My advice to anybody in a leadership role in this organization should understand that they must have the courage to drive change, and they must not be afraid to take risk in that effort to drive change. At the end of the day, we do all this courageously to improve the lives of the people we take care of in our communities.
We always remember it's about the patients. It's always about the unfunded, least served patients and clients that we've got. Then all the other issues will probably go away. They'll get resolved. I'm confident we've got great people here. We'll bring that forward, and great board members that will continue to keep us on track. And the Methodist Church, of course, will always keep us faithful to the social principles.
We can become a model. We serve 74 counties of the state of Texas. If there were other organizations like us throughout Texas and throughout the United States, imagine the impact that we could have on the health care of those that are underserved. not only in Texas, but across the country.